Cardiology is in a really continuous evolution. Diagnostic methods in cardiology are really accurate, and we have non-invasive diagnostic tools and invasive diagnostic methods. Invasive implies, for example, coronary angiography, that we need to puncture and we need to just go with a catheter inside your vessels or your arteries. Well, in the non-invasive methods, I will focus my attention in that, and we have started years ago, decades ago, more than 50 years ago, with ultrasound. Echocardiography uses ultrasound and is able to really diagnose what's going on with your muscle, with the heart. It's able to analyze what is wrong with your cardiac valves, or is able to analyze what is wrong with the pericardium or the aorta. But with echo, it's not possible to analyze the coronary arteries. So with echocardiography, we can analyze the cardiac function, but it's not possible to really see what's going on inside your coronary arteries. If I move forward, then we have cardiac magnetic resonance. It's non-invasive, it's no using radiation, it's quite accurate, and it provides the best tool for a really accurate and detailed information from the morphological aspects. Again, the cardiac function, how is the muscle, how is the heart, and the cardiac valves. But again, it's not easy with cardiac MRI to see the coronary arteries. There are some specific systems, machines, and protocols, and I will say, not in many patients. It's possible to see the coronary arteries, but it's not as routine. More recently, years ago, but more recently, we have cardiac CT scan. With cardiac CT scan, it's very easy, I will say, it's quite accurate to see the coronary arteries. And it's really a great method, because for the first time, in a routine basis, with a non-invasive approach, we don't need to puncture the artery. It's possible to see the coronary arteries. And this is great, but you need to pay a price for that. So CT scan is using radiation, so it's not really recommended to do in a continuous way a CT scan periodically, but you can see the arteries. I think it cannot be a recommendation, a general recommendation when to do that. Still, we need some more detailed guidelines on that, but on a patient-to-patient basis, you with your doctor need to really analyze your specific case and see what type of test do you need and what can be provided with those tests.